Now. And with that, I'm handing over back to Brian to start when you're ready.
Thank you so much. Can I just share my screen?
I told these.
Sorry about this technical glitch.
Okay, colleagues, welcome to the Global Coalition to Address Synthetic Drug Threats, Subworking Group 3.2 West, April 24, 2024. My name is Brian Morales. I have a few administrative announcements to get us started, focusing on the meeting schedule, the website, the initiatives, and the recommendations. I want to start off by thanking all of you for your valuable partnership and participation over the past months. We continue to see the synthetic drug challenges worsening, and we see the emergence of new synthetic drugs and their rapid spread. Countries now we also see facing national emergencies. We saw Sierra Leone a week and a half ago, the president of that country declare a national health emergency on the synthetic drug called Kush. And at the same time, we are redoubling efforts. There's a lot of enthusiasm by the international community to come together and address this in a much more intensive and coordinated way. The topic of synthetic drugs was prominent at the CND this year. We saw many national statements about synthetic drugs and about the coalition. We had two coalition meetings, one on donor coordination and one as a general informational meeting on the coalition. And then we also had several side events that were hosted by governments, by international organizations, and by civil society. One civil society organization that caught my attention was the Global Initiative on Transnational Organized Crime, and they published the map that I have here on the screen. This is the last 2 years, we've seen an increase in severity of the illicit synthetics market, where you see the red countries shaded. We've seen the orange countries have remained unchanged in their severity, and we've seen a decrease in severity in green. So the problem seems to be getting worse around the world, and that is why we are redoubling our efforts to respond to this challenge. The meeting schedule currently, we are at the middle phase of the first year. We are now in action planning and implementation beginning this month of April and continuing through July. And in what ways can we participate? What do we mean by action planning? What will we do during these 4 months? Well, some things that we can do are sharing of national experiences. If you are interested to present on a topic of interest related to Subworking Group 3.2, please follow the link in the chat that we're pasting, or you could see it here on the screen as well, and share with us your interest to participate in the conversation and to deliver a presentation. We will also be continuing our discussions of global initiatives, the ones that we've discussed in the past as they enter their new phase, or perhaps new initiatives as well. We're looking at how best we can engage other sectors like civil society and private sector and create space for presentations. And one thing that we probably will not have time for are workshops or training opportunities during the hours of this meeting, but we are looking at doing this event in addition to. So we'll be speaking with our friends at UNODC who have a wonderful training for policymakers on addressing drugs, and would love for those that are interested to be able to avail of that opportunity. Recommendations. We currently have, I have there 60. We did have 60 at the beginning of last week, but then we lost some and we added some, and we're going to add a few more, I think, by the end of the next subworking group. So I'm not sure exactly where we will be numerically, but we're around 60 at the moment. The goal is to finalize them by the end of today's session. And from there, we will move on to actions. That is, what concrete measures are we going to adopt individually as government representatives within our area of work in support of these recommendations? And what is an action? What can I do in terms of reflecting or sharing that I'm adopting an action? Well, an action first and foremost can be expressing interest in one of the international organization initiatives. We have now compiled 115 initiatives across all of the subworking groups. They are on the coalition website under the initiatives tab, and I'll show you in just a moment how to access those. Second, you can provide financial support or in-kind assistance either to an international organization or bilaterally to another country to advance a synthetics topic of interest. Third, you can adopt a new practice, a policy, a regulation, or law. This is national, domestic action that you are taking and sharing with us. Fourth, you could consider engagement and collaboration with your private sector. And fifth, you might consider hosting a regional or global meeting of the coalition on a thematic area of interest. And so if you are interested in doing this, please reach out to us at syntheticscoalition@state.gov. I'll show you the email address in a moment. And we can discuss how we can set up one of these regional or global meetings. So we're now going from actions, which we're identifying beginning in April, and we'll be asking you to identify these actions, to international initiatives. Those will take place between April and August, and then to achievements. We are hoping that by July of this year, we will produce a report that will have compiled the achievements of the coalition from July of last year through July of this year, and we will be releasing that in September at the UN General Assembly meeting in New York. And then in October, we begin the full implementation phase, where all of our initiatives come front and center, and the international organizations are very much leading and carrying forward the global response through the different initiatives. We continue doing our domestic work and reporting on that as well. And for what purpose? For the development of outcomes and making sure that by the time of the year 2 report, which will be shared in September 2025, that we have concrete results from the work that we have undertaken in terms of addressing synthetic drug threats. So where do we find these initiatives? Here's the website. Middle tab, you can see initiatives is located there. When you click on that, you will then enter the listing of the sub-working groups. You can either click on them or you could keep scrolling down and you will see the 115 different initiatives. As you go through them and you click on one, you will see the title, the description, accomplishments, activities, outcomes, and at the very end, you'll see the flags of the countries that are participating. If your country is already listed, you could still write to the international organization at the email address that's just above the flags and say, I'm interested to participate, and they will add you to their list. If your country is not there, then you're even more than welcome and encouraged to also write back to the international organizations and let them know that you're interested. In many cases, there is not a cost associated with adding one more country to a grouping where there's collective training, collective sort of action that's taken. In other cases, more in-depth domestic work, national work is required, and therefore there may be resource implications for that. International organizations are funded by have many sources of funding. They may have sufficient funds, but if they don't have sufficient funds, then INL, our office, will be working with other donors to see if between us we can increase the support to the international organizations to be able to carry out sort of increased work with more states, assuming that the demand is greater than the availability of funds. So now we're looking at a new website feature also. It's called the Coalition Discussion Board. Registration emails were sent to all coalition members, and that was back in February of this year. But if you misplaced the email or didn't receive it, no worries. There's our email address that I was referencing, syntheticscoalition@state.gov. Please email us and let us know that you'd like the registration link, and then we will send that to you so you can register a password. And then once you have that password in hand, you'll notice that there is a login button up at or link up at the top right. When you click on that, you go to the login screen where you enter the email address that you registered with the coalition or your username and password. And when you enter that, you'll notice that the upper right-hand corner now has your profile, and also it has a community tab. And when you click on that, the community link, you enter your personal sort of profile, and there you will see all of the tiles for the working groups that you are a part of, and you can add more than those if you would like. I'm going to just click on one, which is 2.2, and when you click on that, it takes you to a timeline that is very much like LinkedIn or Facebook, so it's like a news feed, and you can enter comments, you can share reports, stories, news articles, interventions, and you can add images, documents. The idea is that as you contribute to that, then you can then have a free-flowing discussion with other participants. For example, I uploaded this one about a week ago about the public health emergency in Sierra Leone. And then our friend Donald Conte from Sierra Leone replied back with some information. And we can have sort of that free-flowing discussion. We can ask questions. And so I encourage you to do this, because while we have these meetings every month, this is a platform that we can use in the other parts of the month when we are not all convened together. So we maintain regular contact and are sharing information with one another. Now I'd like to conclude by going to the recommendations, and then I'll turn it over to our co-chairs to moderate the first agenda item, which will be the discussion of the recommendations. We look to finalize these recommendations today and then post them on our website by Monday of next week. So added to the top of the recommendations document will be this chapeau that I'd like to read for all of you so we have interpretation and we cover it. It is the following. The recommendations herein are non-binding and for future government consideration where appropriate. They reflect the views of technical experts participating in the global coalition and do not reflect a consensus of governments or a single national position. We included this here because while many of us participate in resolution negotiations and official sort of negotiations of multilateral fora, this is not an official national position. We are technical experts comprised of government representatives, but we are providing our technical expertise in coming up with these. And the idea is that we have some principles so that we are able to anchor our initiatives within recommendations. And they're not just kind of a random assortment of initiatives, but that they have a structural framework. But countries are free at the national level to adopt one, more, or none of these recommendations. They can also have additional recommendations outside of these. With that, I'd like to move quickly to 3.2, and we reviewed them. Actually, I don't believe that we reviewed them at the last meeting, so I will read them all one by one with their edits, and then I'll turn it over to the co-chairs to moderate the discussion if there are any edits or changes. So let me start with recommendation 36. Develop strategies to improve access and uptake of medications for substance use and substance use disorders. Expand medications for the treatment of opioid use disorder. Expand naloxone availability and access within communities, as well as health centers, including training for practitioners and active users, first responders, and other groups that are likely to encounter an overdose to prevent overdose deaths. Promote post-overdose intervention programs where appropriate and in accordance with national legislation and regulations, and develop strategies to improve access and uptake of medications for substance use disorders, specifically medications for the treatment of opioid use disorder, including data reporting systems regarding naloxone provision, both with the public health system and by first responders, to further evaluate the impact of availability. This recommendation combines 36 and 44. That was a recommendation from the working group in the East region to combine 36 and 44, which is why this is so long. 37. Work together with relevant stakeholders, either government or non-government, to support the registration and procurement of essential medications in addressing drug use and drug use disorders, e.g., methadone and naloxone, etc., in interested countries to address market-driven shortages. 38. Develop and implement scalable interventions for the treatment and care of stimulant use, concomitant use, physical and psychiatric comorbidities, and other emerging drug use disorders, including contingency management. 39. Expand access and improve coordination between promotion, prevention, screening, early intervention, treatment, care, recovery, rehabilitation, and social reintegration services for all, and particularly for marginalized communities or vulnerable populations. 40. Promote evidence-based treatments for substance use disorders, adopting national quality assurance systems of care or national standards in treatment in countries where it has been established, based on the UNODC, WHO international standards for the treatment of drug use disorders. 41 has been merged into 53, so I will read that when I get there. 42, develop and implement age and gender responsive women's prevention, treatment, and recovery services where appropriate, and concurrently expand and improve the quality of workforce providing these services. 43. Develop strategies and guidelines, including for public, law enforcement, and local communities, to increase the understanding of substance use disorder as a disease and to recognize and reduce substance use disorder related stigma as a barrier to treatment and social reintegration. 44 is the text that was moved up to 36, so I moved that in its entirety up based on the recommendation from the East Group. 45, promote a national comprehensive treatment system and national recovery network with support for local implementation involving relevant stakeholders such as local political authorities, local government agencies, education, health, social affairs, culture, sports, public security, among others, the community, and local social organizations. 46, create and promote a system for continuity of care for persons with substance use disorders, including identifying and strengthening each level of care and addressing local needs. 47, implement integrated systems or mechanisms for recording information to monitor and evaluate treatment services. 48, promote social integration to foster the consolidation of effective treatment and rehabilitation to contribute to prevention and the reduction of stigma and to provide greater sustainability to change. 49, differentiate consumption patterns according to their intensity and associated risk for the individual and for society, and develop scientific interventions targeted at different patterns of use. 50, identify gaps in providing care for the population with drug use problems with emphasis on synthetic drugs. Now, 51 and 52, we had a recommendation also from the East Group to merge those together. So I have taken 51 and fully put it under 52. And so it reads, integrate the care of people with drug use problems into mental health services and integrate services for co-occurring mental health and physical disorders in the substance use disorder service delivery. 53. And 53 is the combination of 41 and 53 together. These are the two recommendations, and East Group asked that we combine those two. Build recovery capital through the establishment of local and regional recovery networks, organizations, and workforce, and leverage digital technology to augment the capacity building and service delivery initiatives. And finally, 54. Establish collaborations across the non-health sectors, unorganized sectors, traditional health systems, religious and faith-based organizations to strengthen these services for substance use disorders. So that is all for 3.2. That is a lot. I will now turn it over to our co-chairs, Drs. Nicolas Pries and Yuri Gutipet from France and Peru, respectively, for running the session today. Thank you so much.
Muchas gracias, Brian. Buenos días, Nicolás, y a todos los compañeros. Un gusto de volverlos a ver, de volvernos a reunir. Bueno, tenemos avanzadas las recomendaciones que Brian ha dado lectura y que incluyen las observaciones hechas por el grupo oriental. Hemos visto que se ha integrado en un solo punto, especialmente en el 36, el tema de este recurso estratégico para el tratamiento, como es la disponibilidad de medicamentos, ¿no? Específicamente haciendo énfasis en la naloxona. Sin embargo, el resto de recomendaciones tienen que ver con las características de los servicios, ¿no? Respecto a las poblaciones a abordar, el tipo de intervenciones, las fases del tratamiento que incluyan la recuperación y la integración social, ¿no? Entonces, creo que se ha coberturado en general las propuestas que desde la primera reunión se han ido haciendo a través de las experiencias y los comentarios, ¿no?, que se realizaron. Abrimos el espacio para poder también hacer los aportes correspondientes de este grupo. Veo que Peter Roger está levantando la mano. Roger.
Thank you, and good day to everybody. In the subgroup 3.1, there was a recommendation to include a very first item that looked at evidence-based practices in prevention. And I might recommend that we, in the same vein, move recommendation number 40, promoting evidence-based treatments, to the very first recommendation of sub-working group 3.2.
If I may respond to that, Roger, actually, so we have 3.1, yes, indeed, but we also have a just working group 3 recommendations, and it's there. If I could just share my screen very quickly just to show everybody. So I'm trying to share a Word document. I'm not sure if how clear it is on the screen, but we have here working group number 3, and it's recommendation 21, which is the overarching for all 3 sub-working groups, that says, where possible, implement policies and interventions that are evidence/science-based, human rights-centered, and sensitive to national contexts and conditions, and protect public health-oriented policymaking against interference from commercial interests. So that is the chapeau, or the, let's say, for all of working group 3. And then we go from there into 3.1, which is prevention, and then 3.2, which is treatment. So is that acceptable that we have that as the chapeau, or do you think we need something targeted under 3.2?
Well, my only thought was that if there is any kind of sense about the order, the sequence of this, of our recommendations on 3.2, it might be useful to, again, focus on the evidence-based treatment services as a starting point, recognizing there is a bit of redundancy from the overall working group 3 recommendations.
Oh, okay. So in other words, a new 36 you're recommending, or do we add some language to 36? Do you have some?
No, I was just suggesting moving recommendation number 40 up to the very front. It's just a small recommendation.
Okay, thank you. Or I should say, is the discussion today on the recommendations, or do we have a presentation lined up? I think I'm looking at the agenda, and I think what we're doing is discussing the recommendations.
Oui, absolument.
Okay, in that case, I'm going to stop the recording again. Okay, if not, I want to thank everyone for their time. Oh, Lisa, you still have your hand up. I don't know if it's a current hand, legacy hand, as we say. I want to thank everyone for the discussions. Wow, very nice, good, energetic discussions on that. I will take all of the comments that were mentioned and also consult with my my team and that all the note taking we've been doing. I see Bill there smiling. Thank you, Bill. So we will get back in terms of putting all of that together into the recommendations. Thank you all so much for your inputs, and please hang on just a couple of minutes and we'll be right back with the next session on 3.3. Take care, everybody.
Thank you.
Gracias.